This is Andrew Phillips, the founder and editor-in-chief of Coach. So this particular month's question, you've seen it before. I'm sure you have. It's very, very common on the testing front and not all that common in clinical practice unless perhaps you work by a bunch of cruise ships. But scombroid. And this particular question, I like it because it is fundamental to understanding why patients with scombroid present as they do. They're going to present as if they had a big histamine burst. And that's because the histidine, which is in certain meats, in particular some of the fish like the tuna and the mackerels, is converted from histidine to histamine. And this is important because, this is what's presenting as this scombroid poisoning is that it is particular to a certain kind of meat, these particular fish. Not all fish cause this, not your simple tilapia or whatever, right? And then also it has to be food that is not properly handled. And you see that classic sort of flushing in the picture with the general erythema. And it's a classic question, but an extra twist to it is why that particular presentation comes. And it makes a lot of sense once you realize that it really is just a ton of histamine, and you need to address it as such with antihistamines. It is a good test fodder question. You need to know the answer to this, and so stash this away in your memory. You may not see it very often, if ever, in clinical practice, but it is such a classic test question. Stick it away, remember it. Scombroid has to do with histidine turning into histamine by bacteria that is on certain kinds of meat, tuna, mackerel, etc., that has not been properly handled. Histidine to histamine. This is Andrew Phillips, the founder and editor-in-chief of Coach, wishing you a good month.